few minutes here to talk about how HSPN has been involved in many efforts. And then we're going to touch on just two of these, especially today. But this is not new to us. So first, I'd like people to know that between 1999 and 2009, the Hospital Research Collaborative provided hospital-level reporting on patient satisfaction in an annual report every single year in emergency departments and acute care. And that work didn't exist before the hospital report. And for those people who are in hospitals today, you would say that's just routine. That's like what we do. We're trying to make the entire health system feel the same way. Next, we participated in an international study in quality and costs in primary care. So since 2013, for more than 10 years, HSPN has been doing primary care surveys of patient and provider experience. And I'm going to show up one slide on that experience. But our next effort was to also move into community. So we developed the home care client and caregiver experience surveys. And currently that is the tool being used in Ontario with over 9,000 clients every month. So in that home care space too. We're not going to talk about those results today, but they're out there and important. Next, we developed a tool specifically for Ontario health teams to use. We're revising that tool right now, particularly in the context of new approaches by Ontario Health and also the Paris study, which has influenced our thinking in this space as well. So in the spring, we'll be relaunching another tool to help complement everything else. And finally, today we have a very special knowledge event on the Organization for Economic Cooperation and Development, or the OECD, which is a global organization with 34 countries from around the world, who created a new way of reporting on health systems. The OECD does a lot of reporting on health system performance. And this is their first effort at using patient voice in the patient-reported indicator survey. And HSPN, we ran this survey in Ontario, and we were the data support for the program across all of Canada. And you're going to see some great knowledge about that because we've been very active across Canada with our colleagues learning about patient-reported data out of there. So let me just say, what do we know about performance? On the next slide, the Commonwealth Fund has been doing some work on our work on patient surveys, and you have all seen this slide. Most of you have probably seen this slide, where Canada does not rank very well on the Commonwealth Fund. And we used to be 10th out of 11 countries, and now we are 7th out of 10 on the Commonwealth Fund in the overall ranking. Although we do perform reasonably well in health outcomes and care processes, the Commonwealth Fund suggests that we are well down the list. However, the Paris study on the next slide suggests we might be a little bit higher up the list. So maybe it depends on what questions you ask. So here, out of 19 participating countries in here, Canada is number 2, 3, or 4. And in the area of equity, we have some gender inequities in some of our aspects of care processes. We're 6th. But you can see in this OECD study that we're going to talk about today, Paris, Canada ranked quite high compared to other countries. We have the Qualicopi C was an early study that I mentioned back and forth. And how you ask questions matters there too. Canada here, if you just asked a yes, no question, how well do we score? And this particular one is people who said yes, that they had good communication in their, that the doctor understood what was important to them and involved them in making decisions, all above 90% on these 4 items across every province in Canada. So if we're just asking yes, no, sometimes we miss a lot of nuance.